Please welcome the next presentation, entitled Time to Adjuvant Chemotherapy and its Predictor Among Post-Operative Breast Cancer Patients at Cancer Treatment Center of Hawassa University Comprehensive Specialized Hospital, Hawassa, Ethiopia 2022, presented by Dr. Adugna Getahun Deboch.
Thank you. Am I audible?
Yes.
So, thank you. This is Dr. Adugna Getahun from Hawassa University. I'm presenting our abstract on time to adjuvant chemotherapy and its predictors among postoperative breast cancer patients at Cancer Treatment Center of Hawassa University Comprehensive Specialized Hospital. So, background, according to WHO, cancer is the second leading cause of death globally, and breast cancer incidence is rising and becoming major public problem in my country, in Ethiopia, which poses a substantial threat for my country with limited oncology centers. We have only 5 oncology centers in Ethiopia. So, as you know, breast treatment for breast cancers are surgery and non-surgical methods. Non-surgical methods with chemotherapy, radiotherapy, and hormonal therapy. So adjuvant chemotherapy is among treatments of breast cancer, which is important for, which is given after definitive surgical management, which decrease the risk of breast cancer mortality and reduce the recurrence rate and improve the long-term survival rate. And so as a statement of problem, we took we had a chance to have a campaign in the 2021 on October, a pink month of breast cancer. We had a campaign on the screening of breast cancer and awareness creation, and we had one patient, and she has a history of breast cancer, and she challenged us with questions. What is your, why are you doing this, and what's your target? Since most patients are having surgery, but they're expecting a lot of time, and they're waiting a lot of time to take the chemotherapy, which makes them, the cancer is advancing, and she told us her unpleasant history, and that's why we come up with this research, and we conduct this research in our chemo oncology center. So even if the selected cutoff point for the definition of early and delayed start of adjuvant chemotherapy was differed, but initiation of early adjuvant chemotherapy improved the survival rate of the patient. Knowing the time to adjuvant chemotherapy and its predictor, it creates appropriate and tailored adjuvant chemotherapy management strategies and guide treatment decisions. So our objective was to determine time to adjuvant chemotherapy and its predictors and method. We took the study period was from September 2020 up to March 2022. And we use hospital-based or institution-based retrospective follow-up study. Our source population was cancer patients attending our cancer treatment center from September 2020 up to March 2022. The study population was selected breast cancer patients. We have inclusion criteria. Our inclusion criteria was all post-operative breast cancers who attended the oncology center and initiated at least one adjuvant chemotherapy, and we exclude those with medical charts are not found or those medical charts are incomplete. Those who didn't undergone surgery, those who took neoadjuvant chemotherapy before adjuvant chemotherapy. So the dependent variable was time to adjuvant therapy, and so results we took more than 205 breast cancer patients. Among that, 155 were included in our final research, and 50 were excluded. The mean age was around 45 years old, and the main target of the research was on time to adjuvant chemotherapy, which is the dependent variable. We calculated the central tendency with median time of adjuvant chemotherapy, which is 69 days, ranging from 28 up to 157 days, and we classified those days in 4 strata, total of 12.9 patients was in the first 30 days. So we took for the predictors of adjuvant chemotherapy, we took log-rank test and Kaplan-Meier test. In Kaplan-Meier test, we used to show the existence of surviving different variables have different surviving difference. So BMI with BMI and surgical complications. Those patients with low underweight BMI took chemotherapy earlier than the others, normal BMI and overweight, and those patients with surgical complications took chemotherapy before other patients. So in the discussion, the median time for adjuvant chemotherapy was 69 days, and which is we can relate these results which conducted in Egypt, in United States, and Turkey and New Zealand, which is more our result is more increased in ours because of there is increased incidence of breast cancer incidence, but it's more of like decreased in than the study in Brazil because of we detect breast cancer more lately, and the education started at BMI and those medical surgical complications are predictors of adjuvant chemotherapy. Thank you.
Thank you so much. Do you have any comments or questions from our judges?
So did you look into the details of the surgical complications? So whether it's related to the infections or to the procedure itself?
Yeah, both of them. Mostly after the procedure, we took total mastectomy here, and it depends on the surgical margin of the surgery. If the surgical margin is complicated with surgical site complications, those patients tend to stay on hospital for the infection. So they will take those adjuvant chemotherapy early. Thank you.
Thank you so much for the presentation. Please give a round of applause.